Good afternoon, ladies and gentlemen. This is Annalise Garrison. I believe that I need to do a new video on how to approach the alternate format questions. And I think, and I am of the opinion, that if we change our ways of thinking about these alternate format questions, that it will lessen our anxiety about these different what we call alternate format questions. I don't think we need to get all up in arms about this, except for maybe the SATA. The SATA is difficult. I don't know why they're doing this. You will get at least 10 to 20 SATA questions. SATA means select all that apply. But let me talk about how we can change our way of thinking about the alternate format questions so that we can lessen our anxiety about the NCLEX. That's what this is going to be about today. First of all, let me start by saying I would like to actually commend the National Council of State Board of Nursing, because now they are finally giving us a chance to demonstrate our knowledge. For so many years, you know that you and I have both been complaining, oh, I'm not a good test taker, I'm good in clinicals. And this is what got us through school, some of us. We were not good test takers, but we were excellent clinicals. So now they're trying to give us a way to demonstrate our knowledge. So we just all need to calm down and approach these alternate format questions in a different way of thinking. This will lessen your anxiety about the NCLEX. You want to approach the chart exhibits as case studies. You want to approach the SATA, select all that apply, as true-false questions. You want to approach the drag and drop questions as a question that, for example, is place in correct order. You want to approach the fill-in-the-blank questions just as they are, usually fill-in-the-blank. Alright, fill-in-the-blank will normally be a pharmacological math question. Alright, and then the hotspot questions will consist of you pointing to a correct area of a picture. These are the different formats that will be used on the NCLEX to demonstrate your knowledge. There's nothing to get anxious about. We just need to understand how to demonstrate our knowledge. Okay? So as I go through this, I'm going to explain each and every one of these steps and how we can study for the alternate format questions on the NCLEX. The second people I would like to thank is actually my tutorees that I tutor, because I took the NCLEX 17 years ago. So these chart exhibits, for example, are something new to me. So I'd like to thank each and every one of you that I've tutored, that you are the people that make my site what it is today. A wonderful piece of caring, loving artwork, really, about the NCLEX, right? So first, let's talk about an example of a chart exhibit. This is actually an example of myself. A 47-year-old client presents to the ER with acute abdominal pain. The client reports they came to the ER a few weeks ago, tests were conducted, and they were sent home with antiemetics and pain medication. She reports a history of asthma. Upon assessment, the nurse finds the pain radiates from the midline of the abdomen to the right lower back. Vital signs are as follows: BP 160/96, pulse 102, respirations 26, and temp 98.6. What intervention would be a priority? Now, apparently, the NCLEX will give you 3 tabs to look at. While you, at the same time, you'll be able to see this question and the answers, but the NCLEX will not allow you to pick the answer and just move forward. You're going to have to look at the chart that they give you in front of you. Now, what are they going to give you? They're going to give you 3 tabs. For example, in this case, they're probably going to give you a lab tab, a history tab, and present circumstances tab. What brought me to the hospital, right? I'm not sure how the NCLEX will present these tabs because, every chart names the tabs differently. But one thing is for sure, you will get 3 tabs. You will have to look at all 3 of those tabs. Make your assessment based on those tabs. You will be able to see this question at all times, and you will be able to see the multiple choice answer at all times. However, you cannot pick the answer without looking at the tabs. Alright? That is for sure. So, let's discuss this. Regardless of what the NCLEX calls these chart tabs, basically a chart is basically laid out the same way. Alright, and in order to understand these kinds of questions, you have to understand the components of a client's chart. For these types of questions, you have to understand the layout of a typical chart. Look for case studies on the internet to practice these types of questions. I'm not going to recommend any book. The only books that I recommend are on my website, caringforyou.net. If you're an LPN, click on the LPN link. If you're an RN, click on the RN link. But I'm not going to recommend any specific book. Alright? As I mentioned, the NCLEX will give you 3 tabs to click on. You look at all the data from the 3 tabs given and base your course of action on the data you have collected. Alright, these are multiple choice answers or a select all that apply. Alright, so they can be either or, these chart exhibits, right? They can be select all that apply or multiple choice. Keep that in mind. Alright, as I said, you must look at all the tabs before advancing. You're going to be able to see the question and the choices, but you have to look at all the tabs before advancing. Now, regardless of what the NCLEX calls these tabs, the charts usually are laid out basically the same. Alright? You as a nursing student perhaps have not had much of an opportunity to really understand a chart, and you won't. You won't. That comes with experience when you get your first job. The first couple of days you'll fumble through the chart looking for your specific area. But basically, a client's chart is set up the same way. Number 1, we have patient information. Patient information consists of the patient's name, address, telephone number, occupation, their employer, their insurance carrier, and family contact information. Alright? That's the patient information. Alright? The patient history in that part of the chart consists of patient history provides a subjective, description of the patient's health and social history. It also contains information about the medical history of the patient's family. This might be important. For example, in my case, why did I present to the ER? Alright, so I don't know what tab the NCLEX is going to have. I'm just explaining the layout of a chart, right? Then we have episodic information. This component documents the patient's current complaint and initial physical assessment. It answers the question, what brought you here today? So, remember back when I said that I had presented to the ER a few weeks before and they had gave me some antiemetics and pain medication and sent me home? Well, this might be one of the tabs they have to select for me. So look at it. Alright? So this is just some basic information of a client's chart. Let's continue with the next slide. Now, continuing to explain the patient's chart, we also have a psychosocial information section. This is the psychosocial information, and it describes the patient's mental health and development stage based on the patient's age. It also describes the patient's current living conditions and social support system, as well as marital status and or number of children, if not a minor. This is really the place for the social worker to go. But it's also good for you to go there to understand the patient's mental and psychosocial history, right? So it depends. The NCLEX may have a tab like this. Depends on the question, right? So the psychosocial history also will give you a description if they are on any, if they've had any previous mental health issues and what medications they were previously on, under what doctor, stuff like this. We also have in the chart what's called medical orders. The medical orders contain orders written by healthcare providers. These can be orders for tests, administrations of medication, or procedures, or any orders the doctor wants you to take on this patient will be in this particular part of the chart. Now, it's not mentioned here, but there's also such a thing as a telephone verbal order. Now, trust me, a telephone verbal order is part of the medical orders, but that won't be on the NCLEX. That's really what we do in nursing homes, after hours, or if a patient needs a restraint, you are allowed to restrain a patient if and only if they are in immediate danger to themselves or others. Even after you restrain someone, you have to get a medical order. So that's what I mean by telephone verbal order. Again, your state may call it something else. The NCLEX may call it something else. It is against the law to restrain someone, but if you must restrain someone, do so, but still get a telephone verbal order, what we call in New Jersey a TVO. I'm not sure what your state would call it, for example. And again, I doubt something like that would be on the NCLEX. But, of course, the tab medical orders would definitely be on the NCLEX. I'm just giving you some ideas. Lab results. The lab result components identify laboratory tests that were performed and the results of those levels. So, in like my example, when I presented to the ER, I said I had been there before. So the NCLEX may give you a tab on lab results, right? There's also a section in the chart for test results. As in my example, I said I had presented to the ER a few weeks before, and they gave me antiemetics and some pain medication and sent me home. But still, you want to look at what test results, if any, did they run any tests a few weeks ago when I was there? Because I'm in the hospital again with the same complaint. So you want to look at not only the test results for now, but when I was there just a few weeks ago, did they run any tests then? So the NCLEX may give you a tab like this, okay? There could be one or more sections of the chart for test results depending on the charting system adopted by the healthcare facility. Some charting systems will have a section commonly performed tests such as EKGs or diagnostic for x-rays. Test results usually contain the numeric or graphical results and a narrative that describes the examiner's findings. So I'll tell you right now, in my particular case, I had a kidney stone, but I don't know how they missed it and they sent me home. They took a CAT scan, they took an MRI, but they still sent me home. So, And they were getting ready to do it. I'm getting a little sidetracked, but they were getting ready to do it again. They were getting ready to do it again. Send me home. And I said, no, I'm not going home. You have a legal obligation to care for me. And so sure enough, they did indeed listen to my pleas and admit me. But they were getting ready to send me home again. Alright? So it's very important to look at previous test results. Alright? A very important part of the chart is the progress notes. I'll read what I have on this slide because this is just a general overview, but then I want to tell you how it really works. A progress note describes an observation made by a healthcare provider, such as a physician, relating to the patient's care. In this case, the NCLEX is only going to use client, but Nurses' notes contain observations by the patient made by the patient or primary nurse. Many hospitals now utilize the multidisciplinary progress note so that all providers from the healthcare team are charting on the same record and the information is shared. I'm not so sure that's a true statement or not. Because what happens is we don't know who the social worker is, we don't know who the doctor is, we don't know who the nurse is, except by their initials. So this may be a very true statement for the NCLEX. They may show you just a progress notes tab, and you have to look for the RN note or the physician note. I know when I was working in the healthcare field, in the hospital, a couple years ago, so we had a space for the doctor. He usually did the progress notes, right? And then we had what was called nurses' notes. That was our area. Then the social worker had their area. Then the activities of daily living, they had their area. So whether everybody has their own section still or not is unclear to me because they computerized everything. I have never worked with computerized charting. I have not. I've been a nurse for 17 years, but now I work for myself, and of course, you know, I help with the NCLEX on the internet. So I'm not really sure how that works, but I know for a fact on the NCLEX they will have progress notes. In real life, they may take this section and break it down. MD, nurse, social worker, activities director, if you work in a nursing home. But just know that all of the notes, all of the charting will be in this specific section of the chart. Whether they break it down or not, I don't know. But for the NCLEX, they're going to have progress notes, a progress note tab. Okay, let's talk about the care plan. The care plan describes details on how the healthcare team will address the client's problems or the patient's problems I have here on the slide. Now, let me just digress for a minute. When I was in RN school, we wrote 30-page care plans. All right, this will not happen in real life. Okay, LPNs you too. I'm not sure how many pages you wrote. Probably 5, maybe 10. I don't know. In real life, these care plans are going to be 1 page. Okay, and sometimes, especially if they're in long-term care, they're going to have it's 1 care plan per problem, per diagnosis. So yes, it's going to be 1 page, but perhaps this person may have 2 or 3 problems. So be aware of that. But usually it's 1 page and it's fill in the blank. I understand why our colleges and universities are doing this though, and our VOTECs are doing this though, because we have to understand why we're doing the actions that we're doing. It's a learning process. But trust me, RNs, we ain't gonna write no 30-page care plan. Alright, so it's not as hard as you think. Alright, and it's usually fill in the blank. Or usually you circle, you know, the diagnosis. But make sure, even though it's one page and it's fill in the blank or whatever, if your patient has a specific problem and it's not on the page, write it down. Be the leader that you were taught to be. LPN 2. You don't know where you're going to end up. Clinic, nursing home. Don't forget the NCLEX's books. But in real life, you must be what you were taught to be. And that is an advocate for your client and a leader for your colleagues, if that's where you end up. All right, getting back to my point here. Then we have what is called a legal component of the NCLEX, right? The legal component of the chart contains the patient's consent forms, living will, and advance directives, and other legal documents that direct how the patient wants to be cared for while in the healthcare setting. This is extremely important. I know for the NCLEX alert, if it is not an emergency, you must wait for the parent, guardian, or whoever has power of attorney. Now, what does power of attorney mean? It means whoever has consent to take care of that person's health care issues. So, if someone comes into the ER or into the clinic and it is not an emergency, you must wait for whoever has legal power of attorney, legal obligation to care for the client, or if it's a minor, you have to wait for their parents. This will be on the NCLEX. Whatever holds up, whatever's in the chart here and under the legal stuff is what you're going to be held to in a court of law. Let me just share a quick story. There was a client, I won't say where, I won't say when, I won't say why, but she coded. So they did a DNR on her. I'm sorry. She coded and they resuscitated her. The facility ended up getting sued for saving her life because they didn't look in the legal part of the chart and saw that she had a DNR, which was do not resuscitate. So if you work in a healthcare facility, it's a good idea to put DNR on the front of the chart or something like that, because in an emergency, let's face it, until you become a seasoned nurse, you get scared. And you don't think to look in the chart. All you know is quick, get the crash card. Alright? So I would suggest that as supervisors that we put DNR on the front of the binder or something where a person can see it really fast, because in an emergency we don't always think to look in the legal aspect of the chart. Okay? So please, I'm a certified legal nurse consultant. It's extremely important that you know your client's legal wishes. Alright? Okay, then we have what we call the MAR. This is the medical administration record. The medical administration record contains a record of the medication orders that the patient's getting at this time. Right now, okay? And when it was administered, what time it's supposed to be administered, all that good stuff, right? Information on the MAR is pulled from the medical orders component of the chart. This is very true. Usually the transcriptionist does this, but you know what? In the nursing home, for example, we do it ourselves, and probably the hospital now too, because, but we do it ourselves. We look at the medical orders, and that gets transcribed over to the MAR, the medical administration record. Alright? And so does often this gets overlooked, and it's important as well. I don't know why it gets overlooked, because on the NCLEX all I see is MAR. Nobody talks about the TAR. What's the TAR? The TAR is the treatment administration record. Okay, what if somebody has a decube? This would be a treatment, right? What if somebody needs a respiratory breathing every 4 hours. This would be a treatment, okay? So the TAR contains the record of the treatments ordered for the patient and when it was administered, all right? And we do sign off on these. These are what we sign off on. But don't forget, we have medical records and treatment records. Wound vacs, respiratory. Actually, if you're in a nursing home, you're going to have the respiratory there. If you're in a hospital, the respiratory therapist will still have this under this part of the chart. Treatments are just as important as medical records. Okay, Garrison, enough of that. Shall we continue, ladies and gentlemen? Okay, this part of the care plan, discharge information, component contains a checklist of things to do when discharging the patient and a record of whether or not it was performed. So, like the teaching is going to be here, the nutrition, whatever we did for discharging. The medications, what kind of medications the patient was discharged on. All that good stuff. It also contains instructions the nurse must give the patient before the patient leaves the healthcare facility. So, for example, because I had a kidney stone that went undiagnosed the last time I presented to the ER, the NCLEX may have a tab, discharge, right? So you may want to look at what they did for me last time. What I say and what was written are two different things, right? So this is where all this stuff goes, is under the discharge information. And remember, if you didn't write it, you didn't do it, all right? So this is very, very important. And as I mentioned before, you'll be able to see the question along with the answer, but you just can't pick the answer. You have to look at the tabs. So, do I know what tabs you're going to have? No, it depends on the scenario they give you. All right? So, the best way to study for these types of questions is to buy any kind of alternate format book, but they're not going to have enough information in there. Really, really, they don't. All right, so go on the internet and look for case studies and answer questions by case study. You know, that's the best way to study for these types of questions. All right, so I hope you found this helpful. Now this is for chart exhibits. The next slide we're going to talk about is SATA. Okay, before I get started with SATA, let me just say there's no concept I have for you with SATA. And I have to be honest with you, even I get them wrong, because the SATA questions can be subjective, right? You can argue why you should pick it or why you shouldn't pick it. I'll give you some advice that a retired Board of Nursing RN told me. She told me, whoever I help, to tell them to approach the NCLEX SATA questions, select all that apply, as a true false. Also, don't assume, for example, if you have to give medication to your patient and, ensure that an informative response is given. Well, I can't make sure there's an informative response because they're comatose. Don't assume they're comatose. Don't assume. Do not read into these SATA questions. Take the SATA questions, select all that apply, at face value. Nothing more, nothing less. She also said to answer them as a true false. Only answer what you know to be true. Try not to guess. I hope you guess correctly if you choose to guess. But she said pick whatever you know to be true or false. And so approach these type of questions as true, false, and only pick the true response. Because if too many people get them wrong, unfortunately, they will be counted against you the day of your exam, but If too many people get them wrong, they will throw them out of the pool. So, if we all want to help each other, it's best to just answer what we know and not guess on these questions. This way, if too many people get them wrong, they're out of the pool. I gotta be honest with you. Don't think because you're getting SATA questions that you're getting expert questions. This is not true. Alright? Right now, as of 2000, whatever year this is, alright, they are beta testing these SATA questions. And, they don't really know what is working and what isn't working. They'll never admit that. I'm telling you. Alright? I know. Somebody told me. So please approach this as a true-false and only pick the true. If too many people get them wrong, it's going to be out of the pool of 3,000 questions eventually. So I don't know how much of a help this is, and whoever's question this is, don't get up in arms and say, "Oh, you're using my material." All right, I'm going to tell you right now, I found your material for free on the internet. So don't come knocking on my door telling me to delete this slide, 'cause I won't. And if you were nicer to me and approached me kinder, I would give you credit. But I'm not going to do so, because there's so many people that have bought your product and failed their NCLEX. Alright? But I'm just using it as an example. I'm not going to answer any emails. Don't bother. Alright? Alright, so here we go. The nurse cares for a client diagnosed with right-sided cerebral vascular accident with dysphagia. Which of the following actions by the nurse reflects appropriate care for the client? Select all that apply. Number 1. The nurse assesses the client's ability to swallow. Is that true? Yes. Pick it. Number 2. The nurse offers the client apple juice. Would you do that? Is that true or is that false? Well, I have to assess the client's ability to swallow, so I would say true. That is true. I have to assess the client's ability to swallow. Number 3. The nurse positions the client at a 45-degree angle. Is this true or is this false? Well, the client should be sitting upright, so I would think this is false, so I would not pick it. Alright? The nurse offers the client scrambled eggs. Truthfully, when I did this question, I did not pick it, but the answer was correct. I should have picked it. I'm only pointing out my faults and my fallacies because it's to help you take comfort in the fact that even a 17-year veteran can get these kinds of questions wrong. Alright? Of course, I'm not a cardiology nurse, so, that could have been part of it. I don't know. But I did not pick this. Alright? And I should have. The nurse instructs the client to place the food on the left side of the mouth. This is false. Why is this false? Because the person has a right-sided cerebral accident. So they should not pick the left side of the mouth. That's the affected side, right? The nurse turns off the television. This is true. Why? Because people with cerebral vascular accidents tend to be distracted easily. So, we want to think about all of these things when we are selecting the select all that apply. Again, don't lose too much sleep over it. Don't think, oh my God, it's a select all that apply question. No. Would you get that freaked out if it was a true-false question? No. So just say, oh, this is a true-false question. And approach it just like that. Then that way you will keep your anxiety level down. So let's go ahead and look at why we picked what we picked. Alright? So we picked number 1, or A, because the nurse needs to make sure that the client can swallow food before giving him anything to eat. So naturally we're going to assess him, right? We picked B because number 2, because although the client may have some difficulty taking oral fluids, it is important to offer them slowly. We did not pick C, as I mentioned, because the client should be sitting in an upright position, not a 45-degree level. So we eliminated this choice. We picked 4, or D, because soft or semi-soft foods are more easily tolerated than a regular diet. Interesting. So we can't assume just because a client has dysphagia that he cannot eat. Alright? He can eat soft or semi-soft foods. I was thinking puree. You see, I thought more into the question than I needed to think. Alright? So don't do that. Don't assume into the question. We eliminated E, or 5, because the food should be placed on the unaffected side, just like I said, the right side of the mouth for the client. The choice said that the food should be placed on the left side. This is not true, alright? The food should be placed on the unaffected side, the right side of the mouth for the client. Eliminate this choice. And F, or 6, was an interesting correct answer. I didn't really think about it, but then I remembered it. Most clients are easily distracted after a cerebral vascular accident. So don't think to yourself, what does the TV have to do anything with anything? Because it did in this case, because CVA patients are more easily distracted. So just to recap for this question, we should have picked 1, the nurse should assess the client's ability to swallow. True. That's true. We picked 2, the nurse offers a client apple juice. True. The nurse positions the client at a 45-degree angle. False, because they should be sitting straight up and down, right? Number 4, the nurse offers the client scrambled eggs. True, because semi-soft food is easier to swallow, or soft food is easier to swallow than harder food. Again, truthfully, I was thinking I should puree everything, and this wasn't a true answer. Okay? This wasn't a true thinking on my part. Alright? The nurse instructs the client to place the food on the left side of the mouth. False. This is the affected side. The non-affected side is his right side. So we did not pick it. And then we did pick 6. The nurse turns off the television. Why? Because a CVA client is easily distracted. Again, I can go over some of these when we do tutoring, but truthfully, I myself do not have the answers to this. I only have a couple. You can get this in any alternate format book. You won't find that much material on the internet. Okay, now let's talk about and give you an example of a drag and drop. Alright, these types of questions can be looked at as place in correct order, which is what the NCLEX used to do. So all that's going to happen here is the screen's going to look a little different. But really, if you think about it, it's the same thing. You know, let me see, what's a good example? You know, giving a patient an inhaler. What is the correct order? When you see something like that, you want to use every single one of the answers, but you got to place them in correct order. Whether it's inhaler, whether in this particular case it looks like it's going to be a fire in a wastebasket. Okay, the nurse enters a client's room and observes a fire in a wastebasket. Place in correct order. Now, this is how we would normally see it on a multiple choice, right? But, you know, don't get excited when you see on the NCLEX that it looks like this. Okay, at the top, you're going to see the question. The nurse enters a client's room and observes a fire in the wastebasket. Select in order of priority. Something like that, right? All we got to do is drop and drag with the mouse, okay, on the actual NCLEX screen. Everything, all of these will move. You drag it here to the left side, or it could very well be that you drag it from the right to the left. All right, don't email me with the semantics. Oh no, it's not to the left, it's to the right. I'm just trying to make a point, okay, for the new people. I'm very happy though that you know your information. All right, and feel free to comment on the YouTube video. Any comments, I welcome any comments. I just don't know if they're going to drag from the right or the left. Again, that's a semantical thing. All right, the point I'm making is that you're going to drag and drop, either from the right to the left or left to right. It doesn't matter, right? But this is the same type of idea. You know, instead of saying, it says select in order of priority. So instead of saying select all that apply or place in correct order, this is there's a fire in the wastebasket, select in order of priority. Now we have remove the client from immediate danger, use the fire extinguisher to put the fire out, activate the fire alarm per the facility protocol, and contain the fire by closing the client's door. So we drag step 1, step 2, step 3, step 4, and then we'll come up with the next slide. And in this slide, you see that we put everything in correct order. Remove the client from immediate danger, number 1. Number 2, activate the fire alarm per the facility protocol. Number 3, contain the fire by closing the client's door. And number 4, use a fire extinguisher to put the fire out. So basically this was a relatively easy one, and I think it's important. So take my advice when I think that this may be on the NCLEX, because everybody should know this, and your facility will have fire drills. So something that happens on a monthly basis, something that constantly happens, will probably be on the NCLEX. So I would remember this one for the NCLEX, and for that you want to remember the acronym RACE: remove, activate, contain, and extinguish. Alright, and that's basically an example of a drag and drop. Just that simple, ladies and gentlemen. Thank you. Let's continue, shall we? Okay, this is important because usually the fill in the blank has to do with the pharmacological math. Now, you may think you know the pharmacological math, and I have so many people say, oh no, Garrison, just skip it because I know it. And I give them the questions anyway, alright? And they make mistakes. And they probably thought they got it right on the NCLEX, and you didn't, alright? So this becomes important. Fill in the blank questions will always be math questions, okay? You want to always completely write out what the question is asking. Don't just write numbers. I've had several people tell me that, they had to write the whole thing. if the question asks you, like, how many milliliters per dose, write that out. Write milliliters per dose out. If the NCLEX does not want you to put letters like per dose, they will say use numeric numbers only, but let the computer correct you. You want to play it safe. The problem is because the NCLEX asks different questions, okay? Pay attention to the entire question, i.e., right answer using one decimal place, it might say, or right answer using whole number, etc., right? So pay attention to the question. Also, in 2 divided doses does not mean the same as twice daily. So when you're doing your math questions, if it says twice daily, don't divide that, okay? Don't divide unless it says in 2 divided doses. So this is why I want you to write the whole thing out and let the NCLEX correct you. Let the NCLEX have a little pop-up that comes up and says use numeric numbers only. Alright, there's a reason they're doing that, because twice daily and 2 divided doses are extremely 2 different things, and I go over this when I tutor. So now here I give you an example of what I'm talking about. Let's look at this question. The nurse is caring for a client who has a prescription for Nerol, 2.5 milligrams per kilogram per day. PO in 2 divided doses. 2 divided doses is not the same as twice daily, right? So the client weighs 160 pounds. The nurse has Nerol 100 milligrams per milliliter available. How many milliliters should the nurse administer with each dose? Write your answer using one decimal place. So we have to pay attention to the whole question, right? So what I want you to do in this particular question, since it says in 2 divided doses, I want you to write out 0.9 milliliters per dose, not 0.91 mLs, right? Why don't I want you to write it like that? Okay, first of all, for 2 reasons. Let's look at this wrong answer, 0.91 milliliters, right? First of all, that's not using one decimal place, so we have to pay attention to the entire question. The other thing is, notice up at the top it says 2.5 milligrams per kilogram per day PO in 2 divided doses. This is why I want you to write 0.9 ml per dose. Write it. Just write it. Let the NCLEX say, oh, no. Alice, we just want numbers. Or Joe, we just want numbers. Right? Let the NCLEX pop up and tell you to only use numbers. There's a big difference between 2 divided doses and twice daily and whatever else they may ask you. And you may have thought you got it right on the NCLEX when you didn't. So take my advice, please. I've been helping for a long time. I know what I'm talking about, and I appreciate your cooperation on that. Alright, because I'm only trying to help you, right? Alright, let's continue. We're almost finished. Good job, everybody. Okay, the last alternate format question I'm going to talk about is an example of a hotspot. Again, I found this on the internet. There's not too much on the internet. So whether you want to or not, ladies and gentlemen, please go to my website. If you're an LPN, click on the LPN link at the top of the page. I have the recommended books for you, the alternate format question. Buy it. Okay? If you're an RN, go to the RN page. I have actually 2 for you, I recommend. Buy them. Alright? Because there's not enough examples of these hotspot questions on the internet, or even in, I do go over, do I? No, I don't have any, even in my own tutoring. And if you look for hotspot question examples on the internet, you will not find them. So please buy a book. All right, but this is an example of a hotspot question. Something like this will not be on the NCLEX. This is too easy. All right, but I'm going to go ahead and use it as an example of a hotspot question, right? The nurse performs a physical assessment on a client, on an adult male. Excuse me. Identify the area where the nurse should place the stethoscope to auscultate heart sounds heard in the tricuspid area. And then again, you are the one that puts the X here. The X will not be there. You point to it, and then the NCLEX will make a mark on it, and then you will go to the next question. All right, that is how these hotspot questions work. Again, don't even think for a minute this question is going to be on the NCLEX. It's too easy. I guarantee you it won't. Please buy a book. Buy a book. You're going to have to spend some money. For those of you who scour the internet, join Facebook, watch the free YouTube videos, you have to spend money if you're going to pass the NCLEX. That is why I tutor. All right? In the course of my tutoring, sometimes I'm surprised that you don't know how to properly, inspection is kind of easy, right? But sometimes you don't know how to properly auscultate. Auscultate means listening, or where would you place the stethoscope. Now listen, the hotspot questions can take any forms of these assessment skills, which is inspection. What would you see? Where would you find it? Auscultation, listening. Where would you place the stethoscope? Do you use the bell of the stethoscope, or do you use the diaphragm of the stethoscope? I'm a bit surprised that you don't know where to find, some of you. God bless you. It's not your fault, I guess. It depends on, we've been out of school for a while, or maybe we didn't learn it. I don't know. But, for example, the jugular vein. How to auscultate that and what it would sound like, okay? Palpation. Hotspot questions could be ask you, where would you palpate something? Palpation means feel for something. Where would you feel it, okay? Would it be light palpation or would it be deep palpation? You have to know when to do that, and I go over that in my tutoring sessions, right? And percussion just means tapping with the fingers to listen for normal or abnormal sounds. If there's an abnormal sound, there's something wrong, okay? Like the stomach should sound hollow. I go over that more in detail in my tutoring sessions, but it's very important that you understand that these hotspot questions can not only take the form of, where would you find or where would you see this, but inspection, auscultation, palpation, and percussion. The other thing that's important on the NCLEX is they ask you to auscultate different breath sounds. Now, I do have a MP3 on my website that does go over this, and it's only $20. And I have adventitious sounds and what disease process that could be. By adventitious, I mean abnormal breath sounds. And then I have what is normal breath sounds. All right, this would fall under auscultation. Alright, so it's very important that you understand your breath sounds. Again, it's only $20 on my website, and I also go over it in tutoring, but of course I don't have this, I'm not going to play the sounds for you when I tutor, but it's very important that you know your breath sounds as well. I don't know what the problem is. I don't know if you were not properly taught in school, or you forgot, or I don't know, but that's why we're here, to help you, right? This is why I want to be here to help you. And remember that the hotspot questions can take any four of these skills when we assess a client. All right, so this brings us to the end of the presentation on how to properly answer alternate format questions, hopefully I relieve some of your anxiety. And if we just change our way of thinking about it, you'll be all right. You know, it won't be easy, but it won't be as hard. If you know what to expect, it won't be as hard. The NCLEX builds on core nursing. You have to know your core nursing. I like to focus on the expert questions because that's what's going to get you to pass the NCLEX. You have to get 50% of the expert questions correct to pass. So I'm trying to teach you expert knowledge. Okay, you can find core nursing with your ATI, all right, your HESI, your whatever, right? I focus on expert. That's what's going to get you passing the NCLEX. All right, gang. God bless you, and I'll see you next time. And good luck with your endeavors. Take care. Bye-bye.
I live for the good times, and you're the good time delivery girl.